You, Rachel. With many witnessing Miami Dolphins quarterback Tua Tagovailoa sustain a third concussion last night during the game against the Buffalo Bills, it's reignited the conversation around the long-term impacts of these injuries and how those who have suffered them can move forward.
This is really hard to watch, as many of you know. Liam Healy talked with several local experts today regarding the evolving understanding of these kinds of injuries. Liam.
Yeah, thanks, Adam. Teresa, most of the care related to a concussion or other traumatic brain injury usually comes more in the short term, following the injury itself. And while not all who get a concussion end up dealing with long-term impacts, for those who do, according to Dr. Anthony Petraglia, a neurosurgeon at Rochester Regional Health, the treatment can share some similarities to how the immediate aftermath of a concussion is treated.
Long-term health, really, when you think about the different approaches, it's going to stem around, prevention and education, as well as, nutrition and all the things that factor into kind of, maintaining a good cognitive functioning and brain health in general.
In a similar way, the short-term treatment is also moving this direction, away from placing people in just a dark room to adding in some cognitive and physical stimulation to a patient's recovery can be beneficial in both the short and the long term.
The analogy is like a tendonitis. If you have tendonitis, yeah, you want to rest it. But at the same time, you want a healthy balance of actually some load bearing on that tendon as well to help reduce the injury and promote recovery. And we're finding that, yeah, with the brain, it's similar.
Each case is going to be unique, though. But there is a lot of research being done now that in the coming years could become part of future treatments, according to Montanaro.
You see in these sort of brain rehab programs, there's a lot of cool technology now that helps to, using lights or sounds or even music therapy and things like that, that help to stimulate different parts of the brain, helps to improve certain facets like reaction time, short-term memory, recall.
And while many long-term cases have appeared in high-profile former athletes and the idea of having a concussion can be daunting for some, most are able to recover with little issue long-term.
More often than not, most patients will heal from a concussion and not go on to have long-term sequelae or issues, not have with a single concussion or even just a few long-term issues like dementia or cognitive impairment.
And both Montanaro and Dr. Petraglia hit this point multiple times during our conversations today. The first step is always going to be prevention. Be smart about the situations you're entering and remember to put your health first before anything else, because while most do recover, one brain injury is one too many. Back to you.